Hey everyone, how are you doing? So in last week's video, what I did, I showed you the complications of a front tooth implant. Okay, so what I mean by this is why a front tooth implant is so difficult compared to a tooth at the back of the mouth. And today what we're going to do is I'm going to show you a quicker way to have a front tooth replaced. But the really important thing is that we still have the old root in position. Okay, if we don't have the old root in position, check back on the other video and you'll see how we do that. So this is what I'm talking about. Okay, so when we've got this front tooth, and this is the one that I'm talking about here, we've got this root in position, and that is our gum line on there. Now it's important that the gum line is pretty good, okay, because the main advantage with this treatment I'm going to suggest is we maintain the gum line. Okay, so we have to have a good gum line to begin with. So I'm going to show you a diagram in a second where we cut this tooth in half in this position, okay, and I'm going to explain what I'm talking about. So this was the problem which I showed in the last video. I'll quickly skip over it, but we've got a tooth in position here. This tooth needs to be removed and we have to consider an implant in this position. So first we look at the gum line, okay, because this is really important. The gum line dictates a lot about the aesthetics of the tooth. So we want the gum line to be all in the same level, and we want the bottom edge of the teeth to be at a certain level as well, okay, and that way it becomes very difficult to know which one an implant is or which one a bridge tooth is or whatever you're doing. We want to create it and make it look harmonious with everything else, okay, so that's one of the key things which we look at. Now once we've removed this tooth, what's going to happen is the bone is going to shrink away, and that's going to cause the gum to shrink away as well. And then this was our original position of the tooth, and if we just go ahead and place an implant copying the position of the tooth, what we find is that the level of the gum at the front just shrinks up. Okay, so the gum it goes higher, it makes the tooth look longer, okay, and this is what I mean. So you can see here that one of these teeth is an implant, and I'm not even going to tell you which one it is, and it's higher up at the gum compared to all the other teeth. In addition to this, because this lady has very thin gums, you're actually seeing some of the implant show through the gum. There's a little bit of grayness just at the neck of this tooth. Now, this isn't anything to worry about in itself. This tooth and implant will probably be fine, but aesthetically, it could have been improved if we had done it with a bone graft and an implant and tissue grafts and things like that. Now, this was a case which I didn't actually treat. I saw this lady as a review, and the implant was placed at our practice by the previous dentist. And I know that I checked the notes and everything, they didn't do the tissue grafts and things like that. So let's have a look at this situation, because here we've got this root in position and we want to do as much as we can in terms of the total amount of treatment that we can do in one sitting. We want to take this tooth out, put an implant in, and get it all done in one go. There's a whole bunch of other cosmetic issues, like we've got these dark fillings between the teeth. We're going to address these. She's going to have teeth whitening, change all of these fillings, but we're going to do this when we get to change this final crown. Okay, the first part of this whole process was remove this broken tooth and get in our implant as quick as possible. So let me show you how we do this, okay? By the way, this is the result that we're going to get. So at the beginning of the appointment, she looked like this photo on the left, and at the end of the appointment, 2 hours later, she looked like this photo on the right. You can tell that we've done some work because the gums are all bruised up, but we've made a really good looking temporary. She's not wearing a denture, so there's nothing removable about this temporary. This temporary is pretty much as good as her own tooth. She has to be careful on what she eats with it, but overall that's what's really cool about this treatment. You don't need to worry about temporary teeth or dentures and things like that. So let's go into a bit of detail and let me show you exactly how it's done. So we've got that same diagram which we had before, and now we remove the tooth. When we remove the tooth, we now have to place our implant in bone. We can't place that implant directly in the socket of the tooth because there's no bone there, right? We haven't given it any time to heal. So we place our implant in a slightly different position, which actually for implants is a better position. But we have to be careful that the long axis of this implant comes out behind the tooth. Okay, now this is important because here there's going to be a little screw hole. So from an aesthetic point of view, we want that screw hole to be behind the visible part of the tooth. And that way we have what's called a screw retained crown. Okay, so in the future, if we were ever to remove it, it would just be a case of unscrewing and that's it. The other option, if the implant angulation is not favorable, so let's say the implant angulation is slightly different, let's say it was something like that. Okay, the angle, the screw hole, is coming out at a different angle. It's coming out at the front of the tooth. Now, I'll do another video on another day about screw retained versus cement retained teeth and what is better. Okay, but for now, let's delete all of my little red marks and just carry on with what we were talking about here. So, what we now do is we put a tooth on there. Okay, so this tooth is a temporary tooth. It's made from composite materials. We can only do this in situations where this implant has gone in and it's tight enough to put this temporary tooth on. And from here, if we just left it like this, it would look exactly the same as that photo that I showed you a minute ago. Okay, it would look really nice. The gum line would be exactly where it should be. But the problem is, we haven't done anything to protect it. So we've got all of this thin bone at the front here, okay? We've got two problems. First, we've got this hole, which the tooth came out of, i.e. the socket, and then we've got all this thin bone. And the problem is that if we just leave it like this, we're still going to have the same effect as if we didn't put the implant in, i.e. the bone is going to shrink back and the gum is going to slide up, okay, giving us that really bad aesthetic appearance a few months down the line. So initially you think everything's really good, but a few months down the line things kind of change and we have this problem. So the way we get around that is that we fill the hole with bone grafting material. Okay, now the actual grafting material, there's a whole bunch of different types of materials which are available. Some are derived from animals, some are completely synthetic, and it will depend on your implant surgeon what they feel is the most appropriate thing here. But to be honest, this isn't a big hole, so it doesn't matter that much. Now this is all good to an extent, but what we also want to do is just add a bit of thickness around the gum. So the next thing we do is we take some gum from the back of the mouth somewhere where there's a good lump of meat. We take that and then we transplant it underneath to protect the socket and underneath the crown of the implant. Now whenever I talk to patients about this, or whenever they hear this from the first time, they do want to run away very quickly. But it's because it sounds painful. I mean, this whole thing sounds really painful, but when you're fully numb, it doesn't hurt. And afterwards, if you were going to get pain from the area where we took gum from, that pain would be very similar to if you had had a really hot pizza and burnt the roof of your mouth. Okay, so it is uncomfortable if you experience that, but most people don't experience anything to that kind of extent. Okay, yeah, a little bit of swelling, that's definitely normal, but we give our patients a fair few different medications to control swelling and pain and discomfort afterwards. Okay, so this is our whole process. Now, in a situation like this, things are slightly different because can you see that our gum line is here, here, and here on these teeth? But here, where we've still got this root, okay, this is a different patient even though it's the same tooth, this gum line is higher up on that tooth. So this is going to create a difficulty because with our previous example, what we were trying to do was to maintain the gum. That was the whole rationale for doing the treatment in that way, was that we're trying to preserve the gum shape because we like that shape. Whereas if we took the tooth out and let the gum and the bone all shrink away, we would be rebuilding, and that's a very different kind of process to preserving what we have. But here, we've got something which is close, but we want to improve it a little bit. So actually all we did was an additional little, almost like a cut, okay? We just freed up the gum at the top so it could move a little bit. We did the tissue graft, we did the bone graft, we did the immediate placement of the implant, all the same stuff which I've just shown you. We did it, but we modified our technique slightly. Now, if you look at this, the gum line here is lower down than the tooth next to it, and it was the other way around in our original situation. I mean, if you look closely, you can see that the gum originally was probably something like that, and all this is new gum which we've transplanted. We've done our tissue graft from the back of the mouth to the front, and we've freed up the gum at the top, and that's what's given us the ability to drop the gum down, creating that harmony between left and right, creating that symmetry there. Now, I have to admit that this temporary tooth doesn't look that great, okay? And the reason is we tried something new in this situation. We tried a different kind of temporary tooth. I wasn't really overly impressed with it, but it's better than having a gap. So I think I'll be going back to my original kind of temporaries that we did in this situation. Now, the really cool thing about doing the treatment in this way isn't only that we get better and more predictable aesthetics at the end. Okay, that is really, really important. I mean, if you're spending a lot of money on implant treatment, you probably want it to look as good as it can probably look. So that is one advantage, but another massive advantage is that all of the surgical stuff, all the stuff which is going to require injections, is done all in one go. Okay, so we have an appointment for the planning, we take our CT scans, we have our surgical guides made, we do all of this beforehand, and then on the day of the treatment, we gently remove this tooth so that we protect that thin piece of bone at the front. We place our implant in its most ideal position because we've done our 3D guided surgery techniques on it, and we preserve the thickness of the bone by doing our bone graft within the socket of the old tooth. And then we seal it with this tissue graft over the top. Now, this is a much more complicated procedure than just putting an implant in, and some implant dentists may not be comfortable doing all of this. I know a whole bunch of implant dentists. I think the majority are comfortable with this kind of treatment, doing this, but some absolutely do not like what we call immediate placement. Okay, so when you see different dentists and they say different things, a lot of it depends on their ethics as well and what they're comfortable doing, because ultimately I think dentists generally do want to do the best within the skill set which they've got. So that's this kind of situation. We can do it for back teeth as well. Okay, so again, this is a slight modification on the treatment. This lady had a full set of veneers done probably about 10-15 years ago. This tooth was already weak. It had a root canal treatment, it had all the post and crown, the typical story in these situations, and over time that tooth just cracked down the middle, so there wasn't anything we could do to save it, so we decided to take it out. This lady wasn't going to let me give her a removable denture. Okay, I don't know why people don't like removable dentures, but she wanted something there, okay, because when she smiles, this was visible. She was going on holiday. She was going to go for a safari in Kenya, I think it was, and we needed to do something. So this is what we did. We took the tooth out really gently using our specialist instruments to gently remove the tooth rather than yank it, and we placed our implant in its most ideal position. So we actually did this freehand because this was done quite a long time ago before I started using guided surgery, and you can see that we've got these little specks all the way around here. Okay, so these things, what that is, it's all little bits of the bone grafting material which we've done to fill in this socket of the tooth. Then, exactly like I showed you, we made a temporary tooth, and the gum looks bruised because it was all done in one day, and this lady had 0 pain after this. Okay, so that's really cool. But if you're really paying attention, you can see that this tooth is actually a little bit shorter than it should be. And the reason for that is that we don't want too much force on this freshly placed implant. Okay, this is really important in this treatment. The two main things, actually there's a million really important things, but the two most important are, number one, the tightness of the implant. Okay, so we call this initial stability, and it's usually measured in torque, although there are other ways of measuring it which are more reliable. But also you don't want to overload the implant. Okay, I don't mind if she eats soft food on it. A little bit of loading on the implant can actually be a good thing, but we definitely don't want her crunching, you know, bones or anything like that on there. That's going to be a disaster. Implant's going to move. We've lost everything. But she was really good, and a few months later we changed it to a permanent tooth, and this is what it looks like. Now, we didn't do a tissue graft in this situation. It was a little bit further back. We didn't see the extra benefit of doing it, and you can see that there's a little bit of a concavity at the gum. If I just make it full screen for you, you can see a little bit of concavity there, and that is if you don't do the tissue graft in that situation. Okay, so this technique that I'm talking about, this overall technique, is called immediate placement and immediate loading. It is a little bit more complicated, but it's got so many advantages for the patient. Okay, the stuff that I've spoken about, the reduced treatment times, the reduced number of sessions where we actually have to give a needle to inject. For some people, that's a really big deal as well. So I hope you found this video useful. If you've got any questions, comments, please leave them below. I do try and get back to as many as I can. Okay, so until next time, take care.